Hello guys, today I will discuss about CA lung. First of all, causes and types of CA lung. The most important cause is smoking, and the types they are small cell tumor of lung and non-small cell tumor of lung. Small cell tumor of lung, they constitute 15%, while the rest of the tumors, they are non-small cell tumors, which include adenocarcinoma, squamous cell carcinoma, and large cell carcinoma. Now, if we see that how do these tumors they arise from the bronchial tree or from the lungs, we will be able to see that small cell tumors and squamous cell tumors they are central tumors, while the large cell tumors and adenocarcinomas they are usually peripheral tumors. Now, how do these patients of CA lung they present? Means that what are the signs and symptoms. So most common signs and symptoms they are cough, which is productive of sputum. Sometimes the sputum it contains blood, and then there is loss of appetite, weight loss, breathlessness, and then there can be a patient can present with mass or different lumps in the neck, and the features which are quite typical that the patient can have CA lung is the involvement of recurrent laryngeal nerve, and patient can present with hoarseness of voice. Then patient can present with swelling of face, showing superior vena cava obstruction, again showing that the patient has got some sort of malignancy or any other nerve involvement like brachial plexus involvement or involvement of sympathetic chain producing Horner syndrome. So all these can be the symptoms and signs of CA lung. Now, what are the investigations? The primary investigation is X-ray chest, and after X-ray chest, we go for CT chest and we do CT guided biopsy if tumor is peripheral. While if tumor is central, then we do bronchoscopy, flexible bronchoscopy, and we take biopsy of any suspicious lesion. Now, here are a few important X-rays which are quite typical of CA lung. I just want to show you, and you can see here that there is a homogeneous opacity in the right upper lung, and this opacity is homogeneous because there are no blackening in between. So this is a sort of solid mass. Here again there is a homogeneous opacity which is involving left lung, only sparing upper portion of left lung. Now this is the CT scan of CA lung, where you can see a mass on one side. This is the bronchoscopy. Here a flexible tube is passed into the tracheobronchial tree of the patient, and we can see the whole tree with the help of camera, and wherever we find any suspicious lesion we can take the biopsy. Treatment is obviously surgery, chemotherapy and radiotherapy, but there are certain contraindications to the surgery. If the patient has got FEV1, which is forced expiratory vital capacity in first second is less than 1.5 liter, it means lungs they have very little reserve. So that patient is not suitable for surgery. If patient has got metastatic disease, if patient has got superior vena cava obstruction or recurrent laryngeal nerve palsy, or there is any evidence of brachial plexus involvement, or there is any other comorbid heart problem or any other problem which puts the patient at high risk is contraindication. Now, as far as the prognosis is concerned, prognosis of small cell carcinoma is very, very poor because the characteristic of this tumor is that it is very rapidly growing tumor, it is central in nature, and it rapidly metastasizes. So, patients, they usually die and they are not fit for surgery. Now, you can also get paraneoplastic manifestations. In small cell CA, you can have syndrome of inappropriate ADH secretion, which will lead to low sodium because of retention of water, and it can lead to confusion. Lambert-Eaton syndrome means that patient has got weakness of muscles, and it improves if patient continues to exert some force. Then patient can have excessive ACTH production, which can lead to cushion. As far as the squamous cell carcinoma is concerned, it can lead to hypercalcemia, and all the symptoms which are related to hypercalcemia like abdominal pain, polyuria, polydipsia, these are all the symptoms, and patient can have hypertrophic pulmonary osteoarthropathy along with clubbing. As far as the paraneoplastic syndrome of adenocarcinoma and large cell carcinoma are concerned, large cell carcinoma patients, they can have gynecomastia, and again they can have hypertrophic pulmonary osteoarthropathy. So these paraneoplastic manifestations, they are important from examination point of view because you sometimes get them in your SEQs. Thank you.